And I'm very happy to have Chanda give us a talk today on taking care of your healthcare. And she knows in and out of the healthcare system. She has been practicing in that system for more than 27 years. And overall, she has been, both Ravi and Chanda have been our good friends for a very long time. And she has worked in the social services in many different ways. She's they are part of many of you may know about this the regular health and soul walk that they have every year, and I have been trying to attend that regularly. And also, she has been in the Hemalkasa and Amte's mission. They also help Jnana Prabodhini and other similar missions through their non-profit organization. And so it is very nice to have Chanda give us a talk today. If you have any questions, you can enter them in the chat box or ask the questions later on. And I think Ravi is also with the same session as same window as Hello Ravi and Chanda.
Hello.
And so he will be managing the slides and so on. So all the best, Chanda. And again, I just introduce you briefly, but please feel free to just tell more about yourself, and then let's get started on this very important topic and a very helpful topic. And again, you can keep the videos on, but I suggest that you keep the sound off. And in any case, I'll be monitoring it, and I'll make sure that all the audios are off. Okay, good. Except Chanda. All right, Chanda, all the best.
Thank you, Shri, for all that introduction. Thank you for giving me this opportunity. I thank you, all of you, for joining me today. I would also like to thank my boss, Dr. Friedler, who gave me a good suggestion. And I like to thank my husband, Ravi, who helped me to do these slides for this presentation. So, about 46 years ago, I was working as a medical assistant in family practice. I didn't know much about healthcare. I was checking blood pressure, weight, temperature, and drawing blood. One day, while I was working at his office, I had some abdominal pain and back pain. I consulted my boss because he was a family physician. He examined me and he said, it's probably the back muscle. And he gave me some pain medication and I felt better. 2 days later, I had some irregular menstrual bleeding. I consulted him again. I told him at that time that I stopped taking birth control pills. And he said, sometimes it can happen when you stop pills, you can get irregular period. So I waited for another couple of days. And then I started, my pain increased, my bleeding increased. So I consulted him again. And he said that it's possible that you were pregnant and you are miscarrying. But regardless, you should see the gynecologist. Next day, I had an appointment with gynecologist. He examined me. He gave me the antibiotics and sent me home saying I have a pelvic infection. I came home that night, just before the midnight. I got worse. I didn't know what was wrong with me, but I know something wasn't right. So I told Ravi to please call my boss and call the ambulance. I don't want to stay at home anymore. He called my boss, and my boss knew right then what was missed. It was an ectopic pregnancy where the pregnancy grows in the tube, and if it's not diagnosed correctly, the tube can rupture. It's a life-threatening medical emergency, and patient can die due to the internal bleeding. So the ambulance came. With the loud sirens and high speed, I arrived at the ER. Since my boss had already contacted the ER, They knew, and the entire operating staff was waiting for my arrival. I was rushed into the operating room. They had to give me 2 units of blood transfusion before they can even do the surgery. Not only that, after the surgery, the surgeon came out and told he had to remove my one ovary and one tube when I was only 23 years old. And he also told me my only way to have children is through adoption. I was devastated. The system failed. Nobody did the pregnancy test. But then I had excellent surgeon. I had great hospital. I had an amazing nursing staff, and I survived. I did not die. Not only that, we researched a lot of research papers later on. We consulted many fertility physicians at East Coast and West Coast in UK and India. We consulted even the patients that had the similar experience. We found out some pros and cons, and we decided to take a chance, and I went through another major surgery, and it worked. We were fortunate. We have 2 healthy kids, so the system worked. So of course, the second time system worked because we were more educated. We knew what to do. We had done a lot of consultation, and we were very proactive. So now, that time I was a patient. Now I'm a healthcare provider. So I'm actually at the both sides. So I decided to take this topic and see where we can go from here. So why healthcare is important? Of course, it's promoting and maintaining our health. It's preventing and managing diseases. It's reducing unnecessary disability and premature death by early diagnosis and early treatment. So yes, healthcare is important. We all need healthcare. So the Webster Dictionary definition of healthcare, it is the effort to maintain or restore physical, mental, and emotional well-being, especially by trained and licensed healthcare professionals working in a variety of institutions. So this is the list of healthcare professionals: doctors, nurse practitioners, nutritionists, nurses, social workers, physical therapists, the list can go on and on. But I also want to include you. You are the most important part of the healthcare system. The institution. We all are familiar with these institutions: doctor's office, outpatients clinic, hospitals, urgent care. But then, it's not showing. Your home. Your home is also important. When you get sick, the first treatment starts at home. Home remedies, over-the-counter medications, leftover medications, advice from your neighbor, your friend, your family people. So your home is also important. So the levels of healthcare. There are primary, secondary, and tertiary. Primary is first point of the entry with primary care provider. And that's why I really say it's important that everybody should have a primary care provider. That's my first takeaway message. Secondary, second contact, often referred by primary care physician for specific expertise regarding your condition. And tertiary is more complex situations where you get surgeries. It's a short term, and we don't need to get into that right now. But let me focus more on primary. So the primary care, when you go to the primary care for annual visits, annual exams, they are important. We can diagnose many things when you come for physical. I will give you the example. Many years ago, I have a young girl who was in her 40s. She has 2 young kids, and she came in to get her prescription medication. And the reason she had to come in because I refused to give her prescription medication since I have not seen her over a year and a half. She came in, it was a short visit, I gave her a prescription for 30 days and I told her, you need to make an appointment for physical. You need to get your complete blood work. She came in and while reviewing her labs, I found out her white blood cells were very high. Right then, I realized she has leukemia. We contacted hematologist, oncologist. She got treatment. She got better. Her kids are grown up now. I still see her in the office and we always talk about her physical that she did not want to get. Going to the specialist, it's also okay, but I think you still need to come to the primary care provider. I had a patient who injured the knee while walking in New York and went straight to the orthopedist. He had a fluid in his knee, so the orthopedist drained his fluid and sent it to the pathology and told the patient that he had a Lyme disease. Started on IV antibiotics. And when we found out, we told the patient, if you have an infection, you need to see the infectious disease. Patient went to the infectious disease, they did the blood work, and she did not have a Lyme disease. So this is what happens. Had the patient gone to the primary care first, we would have done the primary workup before sending to the orthopedist. This is how we are going to reduce the cost of our healthcare. Our healthcare is extremely costly. That's the main problem of our healthcare. And if we cannot avoid going to the emergency rooms for no reason, where you can, emergency rooms are only for life-threatening medical emergencies. But oftentimes our patients go there because it's just convenient. You can go after hours, you can go on the weekends, so you don't have to take time from your work. So let's go next. So the importance of PCP. I gave you one example. PCP focuses on the whole patient. PCP is the coordinator of the healthcare needs, and PCP ensures timely delivery of appropriate healthcare. Let me give you some more examples. I had an 18-year-old teenager who came for sore throat. He had multiple strep infections in the past. He had consulted the ear, nose, and throat with his father, and the ear, nose, and throat had told him that if he gets more infections, he may be the candidate for removing his tonsils. So this time he had an infection. He called his ENT and they did not have anything available for a couple of days. So he came to me. I saw his throat. He definitely had an infection. But when teenager comes with the throat infection, we also have to think about mononucleosis. It is a kissing disease. It is more popular in teenagers. And what happens if you have a mono, sometimes your spleen can get enlarged. And while contact sports, you are at a risk for rupturing your spleen. So I asked the boy, do you have any stomach pain? And he said, yes. His father was surprised because boy had not mentioned anything about the stomach pain. So I asked him to get on the table. While I was examining him, I found that he had a lot of pain in the right lower abdomen. He had an appendicitis. I told his father he need to go to the emergency as soon as possible before the appendix can rupture. The father, I don't know how much father believed on me because he came for the sore throat. Well, father did take him through the ambulance and he did ended up having the appendectomy. So this is the thing where we see patient as a whole. If he would have gone to the ear, nose, and throat, I'm sure the ear, nose, and throat had no reason to do his abdominal exam because, his throat was infected. We had so many examples of all these things. I had another patient who, a couple of years ago, I went in the room. He stood up. He shook my hand and he said, thank you for saving my life. And I had no idea what he was talking about. I found out a couple of years before that visit, he had come for upper respiratory infection. and his blood pressure was slightly up. So after my exam, I checked his blood pressure. While I was checking his blood pressure, I saw a lesion on his arm. I asked him, what is it? He said, I don't know. It has been there for a couple of weeks, but it's not bothering me. I told him, I'm not happy what I'm seeing. You should see the dermatologist as soon as possible. Well, he took my advice, saw the dermatologist. It was a melanoma. Fortunately, he got early treatment and he was fine. So my whole point of giving these examples are just telling you how important it is to have the primary care provider. When you go for your visit, it is extremely important that you're prepared for it. Bring a prioritized list of concerns and questions. It really helps. It is time. You can save the time and we can save the time. Bring someone else, because having 2 extra ears help, and they can also give us more information sometimes that you can miss. Bring the list of medications or bottles themselves, because primary care is not the only doctor you see. You have cardiologist, oftentimes you have endocrinologist, and they can change your medications. If we don't know what medications been changed, we don't know how to treat you sometimes. So primary care provider are the one that should have your complete record. Anytime there is a change in your history, we need to know. That helps for your health, and that helps us to make the diagnosis properly. During your visit, focus on important concerns. We recommend maybe 3 or less, because if you have a laundry list, it distracts you and it distracts the providers also. And we simply don't have time to address each and every concerns. We have only 15 minutes for a regular visit and 30 minutes for physical. In that 15 minutes, we would like to make sure that we look into your main concerns and you get treated for that. Listen carefully, make sure you understand, ask us questions. If you don't know what exactly we are saying, keep asking, take good notes. That will be very helpful. So, important medical record. That is again your responsibility. Your family history, your medical history. We don't know unless you tell us. It's constantly changing. Your medical history can change if we don't see you for a year or 2. Your family history can change. We need to know if there is a history of heart disease, cancer, diabetes, depression. Those history questions are extremely important. Medications and allergies. You need to know your medications. You need to know the allergies to your medications. We don't want to hear, I take pink pill and yellow pill, and I was taking something last week, but now I'm taking something different. You really need to know your medications and your allergies. Emergency contact information. We need to know whom to contact when there is an emergency. Those contact numbers can change. Your family can move somewhere else and you have a different contact information. Health insurance. When you get your health insurance, you get the booklet. That booklet tells you which labs you should go, which providers are in your network, which providers are out of network. And you need to know that, because when you call any office, they may not be in your network, but they can still see you. And when you go, you have to pay out of pocket, which you didn't know. So it is important that you know who are your in insurance. I'll tell you my example. I had a shoulder pain and I went to see orthopedist. He took the X-ray. I knew the orthopedist was in my network, but his X-ray facilities was not. So I got the bill for the X-ray. I didn't get the bill for his visit. And that I did not know. Fortunately, because I knew him, we sent him so much patient, he wrote off. But that won't happen to everyone. So you really do need to know that. Advanced directives for healthcare is like a living will. Everybody should have the living will. Not only that, you should have one copy and your primary care provider should have one copy. That is the one that tells us what is your decision about your treatment and how do you want to be treated if in case you are not able to make that decision when the time comes. So the advance directives is also important. So these are the things I'm going over because this is our responsibilities. When I say our, I see myself as a patient and primary care provider. We need to make this information available and it has to be handy with, you have to have the records of all the information. I would also suggest that keep this laminated card in your wallet. Just like you have a credit card and driver's license, you should have your name, your allergies and medications that you're taking, the main contact, your primary care provider and your family member, and your health insurance. So this is my laminated card that I'm just showing. This is something I'm just going to do quick thing. The annual wellness visit is only for the patient who has Medicare. It is not annual physical exam. It is not mandatory, but it includes your health risk assessment, review functional ability and level of safety, medical and family history. It is also screening for depression, dementia, and check your vitals. This helps you to make the personalized plan depending on your current health situation. So the Medicare wellness exam is very important. So I don't have lots of slides. I'm just talking the same thing. What is your responsibility as a patient, as a healthcare member, what you can do. And so my main thing is please establish the primary care physician. We generally see patients once a year for physical, every 6 months if you have any chronic conditions such as diabetes, hypertension, thyroid, depression, whatever. If you are taking a prescribed medication for a chronic condition, you need to be seen every 6 months. We see you every 3 months if your chronic conditions are uncontrolled. If diabetes is not well controlled, if your blood pressure is not controlled, we need to see you every 3 months. And then we see you every month when you are diagnosed with new diagnosis. When we start a new medication, we want to see you in 1 month to see how you are doing. Is the medications working? Are you tolerating them well? So again, you need to know your medications, you need to know the side effects, you need to know your allergies. You need to be proactive in your health. There are many treatment options. You can tell us, what you think, how you feel about your treatment. If you don't say, we have no way of knowing. Your primary care, you can tell him anything and everything. Your privacy is protected. Whatever you are telling us will not go anywhere unless you give us the permission. So you can really trust your primary care provider and talk to him about anything. Oftentimes, patient does not feel comfortable talking about the mental health. I remember I had one time a patient came in, a 6 foot, 175-pound big guy came in for physical. And after everything, when we do physical, we literally ask head to toe questions. So one of the questions, do you have any mental health issue? Are you depressed? Are you anxious? And as soon as I asked that question, this big guy started crying. He was literally sobbing. And, he was going through a lot of, job issues, family issues. So you have to trust your primary care. So your primary care can know what's going on. You need help. You really need to be open with your primary care. Know your health insurance coverage. I talked about that again. Maintain a healthy lifestyle. I mean, we all know, the nutrition, diet, the hydration, the exercise, the weight maintenance, stress relief. We have many talks on Sri Yoga, on nutrition, on fall risk. So please follow those advice. Social connections. Social connections are extremely important. Get involved in social activities that you enjoy. Fortunately, we have a lot of opportunities. There are senior centers, there are classes offered in the libraries, there are book clubs and bridge clubs and walking groups. So, try to get involved. Try to, you need to feel that you belong to some group. That really helps. The physical can affect your mental health, and your mental health can affect your physical health. Explore the alternative living arrangements if you're living alone. CCRC, the Continuing Care Retired Community, we have a lot of availability in the area. They really help you because you can get the socialization and you can live the maintenance-free, headache-free, life there. People really enjoy it. If you are living alone, you definitely should consider that. And if you don't want to move out of your house, which I understand, a lot of people like their home, but then at least make sure that your home is risk-free, fall-free, clutter-free, no rugs. You have bars and handles wherever you need it, the shower handle. So at least have somebody evaluate your home and make sure your home is arranged according to that. Maintain open communication with your friends and family. That really helps you to avoid the loneliness. Our Surgeon General, Dr. Vivek Murthy, says loneliness is a big concern for public health. And 2018 data shows that 1 in 3 people over 45 are lonely. And loneliness can affect your health, your physical, your mental health. So get involved in the social connection. My last slide. You take care of your body and your body will take care of you. Sometimes that doesn't work. There are people who get cancer, get autoimmune diseases, but still, you have to continue to take care of your body. You are the most important part of the healthcare system. And then you have to know you are not alone. There are people, your primary care, your healthcare, there are people to help you. I started this presentation with my experience 46 years ago. And from that experience, I realized when I did not know anything about pregnancy or anything like that, I suffered. But then when we took charge of our situation, we got success in that. So that is my take-home message. So, I'm open for question and answer. I'm here if you have questions anytime later. I can help you. I won't be able to diagnose and treat since you are not my patients, but I'll help you to guide on the proper path. So I hope it is helpful. And thank you very much again. I'm open for questions.
Thank you very much, Chanda. Wonderful presentation. You can see the chat box, just lots of messages about how excellent this presentation has been. And you can close the slide sharing, and so that way people can see the entire screen and may be able to ask questions.
Okay.
Good. Okay. So again, I don't see that many questions. Ravi, do you see any questions in the chat box? There are more, comments rather than questions. But I think anyone that wants to ask questions, you can just raise hand and or just unmute yourself. Go ahead, Raj.
Hi, thank you, Chanda. Excellent presentation. Really enjoyed your real life experiences and examples. Very meaningful. Question is regarding HIPAA and in terms of privacy and just trying to understand. I mean, I had one experience where I wanted to share some information about tests or visits to the doctor, a primary care physician, and they would restrict in sharing this information with the family members. So just curious, because it's different cultural aspects, right? I mean, in India, there's hardly any privacy when it comes to, at least for family members. So any comments on that, Chanda, for HIPAA related things, and how can a primary care physician or a practice share this information with family members?
So if you want to share the information with your family members, you have to let them know. There is you can sign the form, and you can say that these members can have the access to my visit or whatever you can think, and we can do that. We get that often with teenagers. Actually, I had a patient who came in for frequent infection, and I asked him, I said, I have to do some more tests because his entire family was my patient. And one of the tests I wanted to do was HIV. And he was shocked. He said, why did you have to do HIV? And then, finally he agreed. I did the HIV, and the HIV came back positive. So I asked him to come in the office. I talked to him and I said, I have to talk to your wife because she's my patient, but I cannot go behind your back and tell her that you are HIV positive. It was a big ethical dilemma. So it was a long weekend coming. He said, well, we have something planned. Give me this weekend and then I will tell my wife. And I said, okay, but you have to protect her until then. So he told the wife, and then next time I called the wife. But yeah, this is the problem. This is, if you don't give us the permission, we cannot talk to the family member. But you can give us the permission for us to talk to the family member.
Awesome. Great. Thank you, Chanda. Thank you. Okay.
Sure.
Anand has a question. Okay.
Yeah. In Maryland, in addition to advanced medical directives and living will, there is a requirement called medical orders for life-sustaining treatment, MOLST. I don't know whether it is same for Virginia or not.
I don't think so. I think our advanced care form that we have in the office that actually pretty much says everything. That when do you want to use
I know,
resuscitation?
But in spite of advanced medical directives and living will, this is a requirement by Maryland. I don't know whether Virginia has the form is called MOLST. Maryland Order of Life Sustaining.
Alka, do you know anything?
Yeah, it's not required in Virginia.
Because we only have that advanced directive that we require them to sign and keep for the record.
When I consulted the lawyer as well as my primary physician, even they don't know about it.
Oh.
But when I checked the county, they said, yeah, this is a requirement and you must fill out this form, get your primary physician to sign it and submit it to us. So
I will check into it.
Couple of my friends finally did that and they said, yes, it is required.
I will definitely check into that. I'm not aware of that, but thanks for letting me know, because I would like to find out.
The other thing which I wanted to share, one or two people that I know donated their body. And there is a special form for it. It has to be approved by your primary physician and then you submit to the county. So at the end of your life, the county takes care of the rest of the cremation and whatever you want. So in Virginia also, is there such a provision?
If your physician doesn't have to sign the death certificate, then I don't know if he or she has any authority, because if the death happens at home or somewhere else and someone else comes and checks it, then the primary care may not even know, right?
May not. But apparently in two cases that I know, they did inform the primary care fellow, say that, look, he has signed this form for donating the body and we are taking the body away. So it's a bit peculiar situation. Most of our family members won't want that, but it's possible that somebody may want it. It's a very noble cause, of course, because the body goes to the medical school, what training or whatever they do. It's a very noble cause, but there is I think from the family side is a lot of resistance to signing this kind of forms.
I think this is Ravi. We know at least one of our friends, his father did that many years ago. So we will get the information from him as to what the procedure was for getting that, and we will add it.
The Georgetown has a form, and my primary physician had showed me that form, but I didn't get that finally. But Georgetown has a printed form which is ready.
In fact, if I could interrupt here, it's interesting that we are talking about this. In Georgia, where I am from, on our driver's license, there is a notation.
Yes.
I mean, I am ready to donate my body. So there is a notation that donor, So I didn't think about it before, but now this question has come up. I mean, obviously, somebody is taking care of it. I don't know who. But yes, in Georgia, there is a provision to say that you are a donor on your driver's license.
We have here in Virginia for organ donation.
Yes.
But
Yeah,
I'm not
yeah.
sure about the donating the body.
Body, yeah.
No, you're right. You're right. It is organ donation. I'm sorry.
Not the
Yeah,
body. Yeah,
It is organ donation. Yeah.
organ donation.
No, you're right. My apologies. I'm sorry, but yeah, it is organ donation.
You have to unmute time.
I am unmute.
Well, can I interrupt? There in Maryland, there is a
you.
form. Hello?
Yes.
In Maryland, there is a form you can request through
Department of Anatomy.
Department of Anatomy. And one of your family member needs to sign, and one outsider has to witness signing. And then basically it's handled by not by hospitals. It's a complete entity who state handles this thing. And, and it looks like it's a very legitimate process.
It's good to know. Thank you for sharing.
Yeah.
You have something?
Yeah, so I was thinking out loud: exercise, diet, and communication. Those are the three things that help me to stay healthy. And I have my sister in medical field and my nephew in medical field. So I consider myself so lucky. So thank you.
But can I say something, Chandaji?
Sure. Sure.
It was excellent slide and excellent information. Thank you so much. Yeah. Even if sometimes, go ahead.
Go ahead, finish your.
Even if you are sometimes in the medical field, you don't know sometimes, because I was in a medical field too, but long back as a medical assistant. But I didn't know there's so many things, as the time passes, by the other friends' mouth and everybody, we collect all the information. But this information, whatever you gave, is very, very important for healthcare.
Thank you.
Yes, thank you so much.
Excellent. No, but I was saying that, seriously, the primary care, we still have many friends and neighbors that don't have a primary care provider.
Primary care, yes.
And, the family practice, I really feel, I've been there, in that for 27 years. There is no money in family practice. There is a lot of headache because, you don't have enough time and you deal with a lot of patients and a lot of problems. But we still have passion for family practice. Yeah. And we do care for our patients. Our patients' safety is our first goal. So, your primary care are really, they do really want you to see healthy. Yeah. So, oftentimes patients feel, so we ask them to come because we want to make money, we want to get that copay. That's not the reason. The copay really doesn't, but the whole thing is because you want that trust built in your primary care. He should have everything about your medical history, family history, he should know everything. But if you don't see them in 2 or 3 years, then the record is not complete. And it gets difficult to, maintain that.
Yeah, you're right.
Nati, can I ask you the question? Sometimes it just happens that you have established primary care, PCP practice, but sometimes there are changes in the practice and your PCP provider moves, or he is nowhere there. And then again, you are in the situation to find another PCP or another practice. And in that time, there is a long wait, about 3 months or 6 months to get on their schedule. Is it everywhere in US, or is it just we don't know, and how to deal with that kind of thing?
So I think right now, unfortunately, there is a shortage of primary care. And because of the insurance and everything, the primary care, it is hard. I understand what you are saying. If you know ahead of the time, so in our practice, if we know this physician is going to be leaving in 3 months, she tries to tell her patient that she'll be leaving in 3 months. There are other providers if you want to see and see who you feel comfortable, and you can start seeing that, or you at least have 3 months in advance to look around. So ideally, yes, your patient should get enough notice so that they can look around to find someone without, before 3 or 4 months thing. But yeah, when this thing happens all of a sudden, or if you know somebody is living in the practice, then you can start looking around sooner. Most of the time, the family practice are a group practice, and usually you get to see almost everyone at least once or twice in your, entire whatever time you've been with them. But it is hard to find, because you want someone who takes your insurance. Not only that, you want someone who takes new patients. Then you want someone who is nearby, not too far. So yeah, it is anybody, even specialist, there is 2 to 3 months wait to see a specialist. My routine eye exam, I had to wait 3 months to get an appointment. So yeah.
Hi, Chanda. That was a great presentation. I just want to emphasize the key point you made, that you must have a PCP. 12 years ago, I had a big issue with my pituitary gland. And I didn't know, because I didn't have a PCP for 15 years before that. So I had no clue, and I came into this office and ophthalmologist and whatnot, et cetera, et cetera. So after that, I've been seeing the PCP regularly, and I've found a good PCP in the system. Locally in Texas, we have Kelsey Care System, Kelsey Seaboard System, which is like Kaiser Permanente in the Fairfax, Virginia area. So it's a system where you have a PCP, the specialist, and all that. So all that system works for me. And I think Sampada, you might find that kind of useful to go into a system like that, where it's then easy to find a PCP and a appropriate specialist sooner than normal, than the 2 or 3 month wait. I've waited for a couple of weeks to see the specialist, but not more than that in this system that I am. But the key is, again, going back to PCP, it's very important to have a PCP. He can figure out issues, he or she can figure out issues with your health, and can guide you to the right place. So, thank you for
Anjali, you have a
Thank
question?
you,
AM?
Yes,
So
Vivek.
there is one question by AM. Is that Anjali? Okay. Anjali?
Vivek.
Or,
येस मीच मला प्रश्न आहे
Okay.
की मला प्रश्न हा आहे की ते जिरियाट्रिक केव्हा, म्हणजे त्याच्यात काय फरक आहे, पीसीपी आणि जिरियाट्रिक डॉक्टर?
So the primary care providers are
Mhm.
the family practitioners can literally see from a newborn to whatever age, 90, 100, whatever. The geriatric, they are strictly take care of the geriatric patients, the elderly patients. So they don't have to worry about young adults, pediatrician, pediatrics patients. So they are mostly specialized. Just like there is a neurologist and cardiologist and dermatologist, the geriatric is just with the elderly population, the senior, where the family practitioners can see the geriatrics also. If the geriatric patient is really complicated, then it might be a good idea to see the geriatric specialist. But I have 90 years old patients, 85, 90, 92, and we see them, we manage their medications,
But you have
माझा
also
प्रश्न
been seeing them for
म्हणजे
20
माझा
years.
प्रश्न हा एकच आहे की कुठल्या वयाला तुम्हाला तसे डॉक्टर हवे?
तसं काही नाहीये. फॅमिली प्रॅक्टिशनर सुद्धा कुठल्याही वयापर्यंत बघू शकतील. पण होतं काय की जेरियाट्रिक काही पेशंट्स आर व्हेरी कॉम्प्लिकेटेड. They have lot of issues, many medications. So at that time, it might be easier for us to send them. So the geriatric can give them more time. They are more specialized. And in that case, we will recommend them to go ahead and see the geriatric instead of seeing us. But otherwise, if we see most of them also.
Okay. पण मी या देशात आता 35 वर्षांपेक्षा जास्त वर्ष आहे आणि माझा अनुभव हा आहे की पहिल्या वर्षापासून मी जेव्हा जायला लागले डॉक्टरांकडे तेव्हा त्यांनी मला विचारायला सुरुवात केली. म्हणजे त्यांच्याकडे प्रश्नावलीच होती की आणि त्याची उत्तरं तुम्हाला दिलीच पाहिजेत. त्याच्यात प्रश्न होते की मला माझ्या घरात सेफ वाटतं का आणि माझ्या घरात माझ्याकडे बंदूक आहे का. आणि सुरुवातीला मला इतका प्रश्न पडला की हा काय प्रश्न विचारतायत, हे कुणाकडे बंदूक असते. पण नंतर माझ्या लक्षात आलं की इथे लोक बंदुकी ठेवतात घरात.
So are you on Medicare?
No. Yes.
No. You are?
Yes.
Okay. So the Medicare does require that wellness visit, and that wellness visit has all that questions that we have to go through. One of the reasons for that is so that we can make the personalized safety plan for you. So if you do own the gun and if there is nobody else in the house or somebody else is coming to take care of you and that person knows that you have a gun, then so we can just specifically train you for that and specifically make your plan personalized for your own safety.
करेक्ट. no, पण इन जनरल मला ते असं खटकलं सुरुवातीला. आता मला सवय झाली आहे त्यामुळे मी पटापट उत्तर देते. पण सुरुवातीला मला असं वाटलं हा काय प्रश्न विचारतात. पण एनिवेज फार छान झालं तुमचं प्रेझेंटेशन.
Thank you. Yeah, there are questions like if you can take care of your own bills and accounts and all kinds of things we have to ask.
हो. मला ते विचारतात. ते दरवर्षी आम्हाला पाठवतात तो फॉर्म आणि मी पाठवते तो भरून. थँक्यू.
आम्ही जेव्हा मूव्ह झालो तेव्हा मेरीलँड टू कॅलिफोर्निया and where we took the residency, our greatest concern was how to find a good internal medicine doctor, because we always believed that he is the person through whom we should be connected with specialists as needed. It took us some time, but finally we found somebody very good. And I must say, he has been very helpful for me as well as Shobha. I mean, we are two different within the same practice, but very helpful. So your point is very taken.
Thank you. Good to know that.
Ragini, do you have a question?
Yes. You are muted.
I have a question. Sorry. Okay, go ahead. I just want to say a big thank you to Chanda ji. I was hoping we could have
one more session because there are so many things that, I mean, this is the first time actually I am attending something and learning so many new things. So can't thank you enough. Awesome.
No, like I told, my phone number and email, I can share it with you, and you can just, anytime you have question, you can ask. Like I said, I won't be able to diagnose and treat since I'm not but I can definitely guide you, to the right path if you have any questions.
That's so nice. That's so nice of you. Appreciate that.
So I have a quick question. This is Ram here from Houston. Did I hear you correctly? Did you say that Medicare, I'm on Medicare, the Medicare requires a wellness check yearly?
No, I take it back. I'm sorry. It's not a mandatory thing. Medicare pays 100% for this visit, so you don't have to pay anything. And this is strictly for your benefit, because you get that personalized plan and risk assessment and everything done every year for you. And it's not a physical exam. It's basically just the personalized risk assessment. We do the we do the test for dementia. We do the test for, fall risk and depression screening and all that thing.
Okay,
so it's not a mandatory.
Something that you request if you want it.
Well, we like to see done Medicare wellness exam every year, but since it's not a mandatory, we cannot force you, but we would like to see, because, after a certain age, every year is important, right? I mean, there can be, it is for your benefit, basically.
Right. So basically you have to ask for it essentially, right?
Yes.
Yeah. Thank you.
Sure. Welcome.
Can I ask
Sometimes
a question?
you get lots of calls about it, that, about wellness tests that your insurance company offers. And so anyway, so you don't have to request. Sometimes you will get that opportunity to, somebody will call you. Anyway, go ahead, Ujjwala.
Yeah, my question to you, doctor, is how different is it? What different things are done in annual physical exam and your regular 3 or 4 or 5 month exam?
So the annual exam, you get complete blood work, your cholesterol, vitamin D, your blood count, your urinalysis, thyroid, everything. And then you literally get head to toe exam, and we get half an hour for that. The 6-month exam, if you are taking a blood pressure medicine, then we would like to make sure your kidneys are okay. If you are a diabetes, we like to make sure that your sugar and your A1C is okay. So we do some exam, some blood work at that time, and it's a short exam. It's only 15 minutes. We just want to make sure everything is okay, your kidneys and everything, because you have a chronic condition. And then the 3 months exam is, if your blood pressure is not well controlled, then we need to find out, do we need to make any changes in your medication?
Okay. Now, if I'm not diabetic, I don't take blood pressure medication. Do I still need to see the doctor every 3 or 4 months?
No. If you don't have any chronic conditions, you are perfectly healthy, you can have once a year.
Okay. But okay, I got it.
Can I ask you something? Oh, okay. You done? Yeah. What is the difference between wellness and yearly physical?
So the yearly physical is, again, you get head to toe exam, complete physical, and the wellness exam does not include any physical exam. It's only all the questions.
Oh, okay. Okay. Thank you. Thank you.
You're welcome.
Chanda, actually, I have a question regards to actually a couple of them. So in the state of Virginia, or even overall in the United States, in some states as well, does PCP have authority, or does they do a type of practice where they can do the home visits in certain situations? And if they do, or they have a capacity to do that, do they require a separate licensing?
So there are some groups that will do the home visits, but they have certain criteria, like if it's a weekend, then the patient has to go to the hospital. But if during the weekdays, then they can do the home visit. But it's a group that decide, and that's what they want to do. But like our practice don't do the home visits. So I don't know what's the requirement for to go the home visits, but we don't do the home visits.
So in Virginia, the such a certain type of, I mean, this type of provisions are made? Okay.
Yes, there are certain groups, they will do the home visits. Yes.
Thank you.
And then home health care, they have nurse practitioners and physician's assistant, they will do the home exam or home visits also.
One more question. When doctor does a video call, instead of me actually going to the doctor's office, or she would do a face call, is that considered as a visit? Is that treated differently?
So, this whole thing started because of the pandemic.
Right.
We were not, we could not see the sick patients in the office to expose the staff or expose the rest of the patients. And now, because it started and it has been working well, it has been continuing. Personally, I don't like the video call. I like to have my patient come in the office and hands-on. Because, if you have the flu and cold and cough and stomach pain, I want to see. I want to listen to your lungs. I want to listen to your heart. I want to feel your stomach. But sometimes what happens is, you need a prescription. You can come in. It's just your blood pressure medication. You're going out of town. Then we'll just talk to you over the phone. Do you have any chest pain, any breathing difficulty? Are you tolerating your medicines well? Do you check your blood pressure at home? Are your blood pressure within the normal limits? And if it's all are okay, then I would probably give you a month or two until you come back and make an appointment in the office. But it is charged the same way. Yes.
Yeah. Just saves you a trip to the doctor's office. Okay.
So because it is getting more convenient for the patient, more and more patients are making the virtual visit. And we still do it. But like I said, I personally like to see patients in the office on hands-on.
Okay. Thank you.
Anything else? Well, it was wonderful. Thank you, Shri. I really enjoyed it.
Very nice, Chanda. Wonderful. And you are very welcome to, give more sessions on Sri Yoga anytime. You have a lot of knowledge, and I'm sure people will also enjoy, talking to you more often. And again, thank you, everyone. And again, Chanda, as Chanda mentioned, that she will provide the contact, and this presentation is recorded and will be made available. Again, there are some people that I don't know, and Chanda, I will share it with you so that whoever is your contacts, you can send it to them.
And I may have some reference material that some of the friends might enjoy it. So how can I send it? Just
you can send if it is in some electronic form, then I can share that information along with the YouTube recordings.
Okay.
So it could be your presentation or some additional information. Then I can share that with everyone. So,
all right. Thank you, everyone.
Thank you so much.
Appreciate
It was very, very
Thank you.
awesome.
Very nice, Chanda.
Very nice.
So wonderful.
Thank you so much. Very nice.
Hi, Anil Kaumudi. Good to see you.